Well, it's time to talk some sports medicine, part of this morning show for over 30 years. It's my good friend, Dr. Joe Congini, Sports Medicine Center at Akron Children's Hospital. Good morning, Dr. Joe. What do you have for us today?
Good morning, Ray. Yeah, it has been a long time, and I started in my teenage years. I think I started when I was doing this show. But, no, it's been a long time, and I enjoy this so much. You know, this is what I enjoy doing, and I'm kind of trying to sort out different things, and it's kind of fun to combine it with seeing what's going on with some of our sports teams sometimes, and then kind of bring it down to the high school, youth, college level with injuries. And what has happened recently, kind of fun again, is our professional basketball team is kind of at a point where, hey, we could make a little bit of a playoff run. Oh, my gosh, a few people even used the word championship run, and they kind of retooled the team a month ago. And it was kind of exciting to watch this retooled team was playing very, very well. And then it's so typical in our area, you know, in our part of the country, in our fandom in Cleveland. Then major issue about 2 weeks into this retool of injuries. And that week happened to be hand, thumb, wrist injuries. And a couple things about it. It's kind of played itself out now. We've kind of averted the crisis. I know people know that. But everybody was throwing around some terms, and I just wanted to kind of give you an idea of what we in sports medicine, how we evaluate these things, to be able to say that, hey, it looks like it's pretty good. You see, last night both of our hand and thumb players are playing and playing pretty well. But what happened is about 2 weeks ago, I think on the 24th, after a game, they tell us, gosh, James Harden's fitting in so good and playing so well. Oh, my gosh, he fractured the tip of his thumb. It's called the distal phalanx. The thumb has two bones in it, and the one at the end of the bone in the thumb is called the distal phalanx, and he fractured the tip of the bone in his thumb on the right hand. He's a lefty. And then a guy who's really given great minutes is a guy by the name of Keon Ellis, and right around the same time, he has a left index finger volar plate fracture, they call it. In fact, in a couple places I read there, they said solar plate with an S. It's volar plate. And we love to use fancy words, so I'm going to try to explain a little bit about what this is.
Please do.
So volar plate injury, the ligament pulls a small piece of the bone away, and that's these smaller fractures. Hopefully these fractures are stable, Ray.
Yeah.
So in differentiating, everyone throws around the term stable and unstable. That's the big deal. If they're stable, people, oh my gosh, they're playing in the same week and they're playing with a splint. And if they're unstable, they're talking about meeting with the surgeons and they're out for a couple months and they may have surgery and they may have a cast. And so what do we mean? There's about four things that tell us what makes it stable and what makes it unstable. So number one is, does it remain in alignment? We knew right off the bat the very next day that his was well aligned, James Harden's. And the other side of the coin is displaced or rotated, the bone shifting, or there's multiple pieces. That's clearly unstable. That's the problem, versus it remains in good alignment. His is remaining in good alignment. Number two area is often, so those can be treated with a splint and return to play fairly quickly. And we've watched those two players come back, and they a sigh of relief. They're both playing better. Initially, it looked like they had a little ball handling issues, but doing much better, versus casting or surgery, as I said. The other is also on an X-ray is does the fracture go into the joint? If it is intra-articular, fancy medical word, sorry, goes into the joint, it is not going to heal very, very well. Neither of these went into the joint, thankfully, and that was really important. That can be told also by an X-ray. The size of the fracture. So just like we're evaluating a high school kid with these, same kind of things we go through, stable or not. The size of the fracture. Many of these are really tiny fractures. They're in good alignment, and they're going to be in the stable realm. Some of them are greater than 20% of the surface of the bone and joint. And if they're greater than 20%, that's just a number we throw out there. Probably going to be unstable and probably going to need to see our surgical friends. Some of it needs to be done by exam, too. It's not all right. So we examine them, and if they are loose and they have some pretty significant ligament damage. There's that volar plate. The volar plate is a big, thick ligament. Sometimes the volar plate gets torn, and the ligaments around the joint gets torn, and it's loose. And if it's significantly loose, it's going to be unstable. And if it's pretty solid and not a bad tear and looseness of the ligaments, it's going to fall in the stable category, and we're happy about that. Now, painful is going to be there on either of these two injuries, so pain is not a guide. So you say, oh, my gosh, that thumb injury really hurt the first few days. Yeah, it's going to hurt for sure with a stable fracture, just like an unstable fracture. So pain isn't a good guide, but examination and X-ray helps tell us some of those factors I just mentioned to you of what makes it a stable and an unstable fracture. And a very good chance, gosh, I talk to the surgeons all the time for years. Are you pretty sure if it's a good, stable fracture that it isn't going to get re-injured? And most of the time, barring a really significant high-impact injury, these heal really well with a splint. And you've seen both of these players playing with a splint. And finally, it looks like we might have gotten some good fortune because these guys really helping the team. It's kind of fun to watch as they get moving again. They beat the first-place team last night, and a lot of fun with Detroit. So we're blessed and thankful as fans, and we are with our kids, our high school kids and others, when they tell you, oh, it's a stable fracture and we can get moving back on the court or the field and playing again versus, no, this is an unstable fracture. Thankfully, many of these are stable, and we use X-ray and exam and not pain as a great guide as to what makes it stable versus unstable.
So, Joe, a couple of things coming off that presentation there about these fractures. One is, seems like you go back to pain tolerance. There will be some pain. My other question is if you have one of these micro fractures or whatever you're talking about that can kind of heal on its own and we can play through it, what are the chances of us re-aggravating it and possibly making it worse? Is that minimal?
Yeah, that's exactly the question I ask the hand surgeons every time one of my star players in any sport would, she'd get a point guard with a hand injury and other things, is what's the chances with these? And these are not, by the way, you use the term microfracture. We talk so much about stress fractures and stuff like that from overuse. And these are trauma fractures, but they don't, if they're stable, they don't move. They remain in perfect alignment. The joint isn't involved. And so they are, and they're pretty, the ligament is pretty solid. Those are the type of fracture that we're talking about. And so with those injuries, they tell us that it would take almost as much force as they had initially to break the joint for it to happen again. And very, very good chance that if that doesn't happen, that they'll be able to play through it and not get re-injured.
That's good news. All right, yeah. And you're right, Joe. We finally get some good news. This time of the year, right, Joe? We always see it with an injury to one of our calves as they're making a run. I know Jared Allen left the game last night with some sort of knee injury. They said he was questionable returning. We'll find out more about that today. But just cross our fingers because, as you know, Joe, those deep runs in the NBA playoffs, there's so much depending on the health of your team.
It sure is. But they're so much fun also, and it's great for Cleveland sports to see us get back into those runs again. I think this team could make a little run.
Yep.
We talked last week, Guardians. I think they could make a little run and have some fun. And so it really kind of energizes the community when they do well. Of course, we have the high school tournaments coming up in basketball and the CAA, March Madness coming up. So a lot of really cool basketball. So we'll be watching all these injuries. We'll be watching all these hand issues. And we'll be talking about them if they rise to the occasion of being necessary on the morning show with Ray Horner.
Well, it's a fun time, certainly, to like sports. I love it. Joe, as always, my friend, thanks for making time. We'll do it again next week.
Thanks, Ray. Have a great week.
You too, my friend. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. Again, part of this morning show for over 30 years with great insight